Welsh Clinical Portal is fundamental for presenting the information. I think it's essential for the provision of healthcare in Wales.
Having everything electronically in one place means that I don't miss really important information that could make a huge difference to a decision I make on a surgical patient.
Welsh Clinical Portal is a key tool in the delivery of care because of the content, the rich content that it has from various healthcare settings along patient journeys.
The Welsh Clinical Portal is a view on information about the patient, such as their demographics, where they are on a ward or their outpatient clinic appointment, for example, which consultant they might be under. It's also their entire diagnostics record, and it's also their digitised documents as well. So it's an all-encompassing view of a single care record for the patient.
A Welsh Clinical Portal is much faster because all information is there, up to date and on time.
The move from paper to a digital solution is always a challenge. However, the Welsh Clinical Portal has been designed in a way that should be simple to use, easy to follow and intuitive to the user.
We use agile methodology to develop our products. We hold user groups to be able to engage with clinicians who are our users of the product. We invite them to these user groups and we listen to them, and they tell us what they would like from our products, how they want them to look and behave.
I really do promote it amongst my colleagues. Why are you using that system? That one's old. Use this one, it's got everything on it. You don't have to keep clicking between different systems. It's all there.
In my daily clinical activity, I use the Welsh Patient Referral Service, which is accessible via Welsh Clinical Portal. Those are the GP referrals that come in a standard format, which means we can direct patients to the appropriate pathways so that they get their diagnosis and their treatment faster.
There's a part of it on the document section where you can add a clinical note, which will keep people informed about what's been going on if you see a particular patient.
Clinical note aspect of it is what I find particularly useful. In my role, I perform flexible cystoscopies. When I see the patients, I can put a note on the system that's accessible for anybody then to see.
It's much faster for any information. You haven't got to go and request x-rays. We used to have them printed out for each clinic, so you'd have the big x-rays in front of you. Don't need that now. You can go into the Clinical Portal, click on there and view all the x-rays.
I use the Clinical Portal mobile app. It means that when I'm not in the hospital, I can easily put in my password to the mobile app and I can see immediately what patients are under my care, where they are in the hospital and what their latest results are.
Information governance and patient safety exists to ensure the safekeeping of the data that we hold about all Welsh residents or Welsh patients.
We see the Welsh Clinical Portal used extensively throughout NHS Wales. Using some recent audit data, we were able to identify the Swansea Bay University Health Board are accessing the Welsh Clinical Portal every minute of every day across the working week and up to 20 times per minute during peak hours.
I think the Welsh Clinical Portal is an absolutely essential tool. I don't know where I'd be without it. I use it every day to help me make safe decisions for my patients.
Going forwards, I don't think you can survive without digital healthcare. I think it's the way of the future.
I'd encourage any healthcare professional to make the time to engage with the digital teams across NHS Wales to get a login, to get access to the system that provides accessibility to over 211 million test results, 35 million care documents, 3.1 million GP records including medicines. It'll help you deliver better care.